all of your coronavirus-related questions. And I think the biggest question we all have right now concerning the coronavirus and social distancing: how long is life going to be this way? Pat Doris has some answers after a news conference with Governor Kate Brown. He joins us now as our KGW Q&A guest tonight. And Pat, what is Governor Brown's plan?
Well, she wants to see a number of things, 5 metrics that she talked about today. One is declining infection rates. She also wants to see a lot more testing. She wants more PPE for the frontline teams that are out there fighting this thing. She wants to be able to do quick contact tracing. So if someone gets ill, they want to bring in a team to find out everyone around them so that this thing doesn't resurge. And then also, when that happens, they want to be able to isolate or quarantine people. I pressed her on a timeline because the state epidemiologist kept mentioning mid-May. Things would be looking really good. She refused to go there, though, and said she would not give a timeline.
Interesting. Yeah. So why not put a timeline in place if she wouldn't answer that? I mean, do you have any, insight from anyone else?
Well, my sense is that so many things have changed so many times. I've been watching all the projections that have come out from University of Washington and the experts up in the Seattle area, and they do change all the time because what's being done with the physical distancing is influencing the rate of infections. And so I think that she's very leery about, throwing a dart at the calendar and saying that date, because if things are looking worse, then that'll be very depressing for everybody. If things are looking better, I think they want the ability to unlock things even earlier.
Let's talk about prisons now. Will she let prisoners out early to avoid infecting them?
No, she won't. She was asked that directly today. She indicated last week that she was maybe considering it because she asked for a list of people who would be eligible. Some other states have done that, but today the governor clearly said, nope, she's not going to do that.
And Pat, what is going on with the federal money for Oregon?
Well, it's interesting. The state's going to get about $1.6 billion from the federal government's bailout because of all of this. But today the governor said she's kind of concerned about that because there's restrictions, strings attached. One of them is that the money cannot be used to replace lost revenues that the states have because of the coronavirus. Well, in Oregon, that's a huge deal because so much of the revenue for the state comes from income tax, and so much income tax comes from people working. And now that there's about 300,000 people that have lost their jobs, that is going to go way down. So the governor's trying to figure how she's going to deal with that one.
Interesting. Pat, anything else come out of the news conference today that you think viewers should know about?
I think that just all the governors that I've talked to or read today, from Governor Inslee to Governor Brown to Governor Newsom down in California, are all sort of using the same verbiage. Makes me wonder if they had a conference call this morning. They're all saying this is not going to be like turning a light switch. This is going to be more like turning a dimmer switch, and hopefully it'll keep getting brighter. But it's going to be gradual and it's going to be slow. And I think right now they're kind of starting the public campaign to let people know, yes, there is something coming, but no, not immediately. They also, both Inslee and Brown, talked to me about rural hospitals. They're very concerned about the economic impact this is having on them. They've canceled all elective surgeries. Nobody's out getting hurt, so nobody's in the ER, and they're not getting this flood of COVID-19 patients. So a lot of hospitals, especially in rural areas, are really in very dire financial shape. So they're both motivated to do something about that.
Interesting. Pat Doris, thank you for joining us and thank you for all of the great information.
It's my pleasure.
We've been told our social distancing for the past 3 weeks is working. Still, there are violators. You've asked, what do you do if you see people not following guidelines? Here's Maggie Vespa.
All right, so Governor Kate Brown, first and foremost, is saying do not call 911 about people not properly social distancing, because she says that's not an emergency. And beyond that, she's sort of deferring to Oregon State Police on this. Her office sending us a statement reading, OSP advises that people may choose to self-educate their fellow Oregonians while maintaining social distancing themselves, or they may call their respective police agencies' non-emergency number. Now, technically, violating the stay-at-home order could result in a Class C misdemeanor, but we checked with Portland Police. They are getting calls on this. They got 82 over the weekend to 911 and non-emergency, but they tell us they're just educating people and issuing warnings. They have issued 0 citations. And we also checked with law enforcement agencies across the state, and that does seem to be the norm.
All right, thank you, Maggie. Now to politics and the coronavirus. Oregon's primaries next month on the 19th. What does a campaign look like during social distancing? We asked PSU political science professor Dr. Jack Miller.
Well, that's a great question because campaigning at almost every level except for the highest level of national office is a very face-to-face kind of thing, and obviously that's off the table. Candidates who are incumbents right now, incumbents usually enjoy an advantage over challengers because they have name recognition, they have ways of getting their face and their activities out to voters pretty easily. So challengers always have a difficulty. Right now, incumbents have an even bigger advantage because they just do their job and use their, and attention is focused on them. So they're getting their face and activities out there through channels like this, like television. Challengers now have to, instead of being able to engage voters face-to-face, going to rallies, having their volunteers knock on doors and pass out leaflets, they have to now use only social media. I've heard people doing Zoom coffees to connect with voters in a kind of personal way, but it's very challenging because politics is a face-to-face business, and obviously that's not available anymore.
Now, at any time, you can send in your question. The number's on your screen, 503-226-5111. If we don't get to your question tonight, we'll be answering questions right here at 7 o'clock Monday through Thursday. And up next, we know you have so many questions about the stimulus check. So how can you track down your payment? We'll have the answer. But first, what is the state doing about complaints saying businesses are violating coronavirus safety orders? Well, the Oregon Occupational Safety and Health Administration, or OSHA, says it will ramp up spot checks to verify that businesses are complying with the governor's orders. There's still so much to learn about COVID-19 and who's in danger. For example, does vaping put you at a higher risk? Our Verify team takes a look.
The Verify team is committed to separating fact from fiction and sticking to the truth. There has been a lot reported on the link between smoking and COVID-19. An early study out of Wuhan, China showed that of those that got pneumonia, smokers tended to get more sick. That led a viewer to ask us to verify, could people who vape be at a higher risk for COVID-19? To find out, our researchers spoke with the director of the National Institute on Drug Abuse and the director of the Tobacco Treatment Clinic at Johns Hopkins. Their answer?
Yes, you are definitely more at risk of having more severe symptoms if you catch COVID-19.
Now we should note, this virus is still very new, and so there haven't been any specific studies on those who vape and have COVID-19. But our experts say that there's definitely enough info out there that we should all take precautions. Our other expert, Dr. Volkov, backs us all up, saying vaping makes your lungs more vulnerable to pulmonary diseases. That puts vapors in a higher risk category.
We don't have the luxury of time. We cannot wait until 1 year from now we have all of the randomized trials that document. We need to be prudent, and even though the evidence is not there, it's much better to be cautious.
So we can verify, yes, our health experts agree that if infected, vapors could be at a higher risk of having severe symptoms from COVID-19.
You know, those relief checks from the federal government should be in bank accounts by Wednesday, by tomorrow. But if you don't get your money, how do you track it down? Lindsay Nadridge has the answer.
If you don't get your payment tomorrow, you can check the status of your payment starting Friday. That's when the IRS plans to launch a new online tool called Get My Payment. This will let you track the status of your payment to find out when it will be deposited into your bank account or mailed to you. For the majority of people, these payments will show up in your bank account automatically. That includes people who receive Social Security and disability benefits. Once you get your payment, the IRS will mail you a letter within 15 days. That says how the payment was made and how to file a report if you didn't get it. We've also had some people ask what to do if there's a mistake with their payment amount. For example, I spoke with one man today who received his direct deposit but said he didn't get the payment he was expecting for his child. Well, the answer is not so clear. I talked to a local spokesperson for the IRS, and was told they aren't answering questions about these payments. They referred me to the national IRS media line and the U.S. Treasury Department media line, but nobody has returned my call yet. For more information, along with links to help check the status of your payment, head to kgw.com.
If you're wondering how much you should get, we've made that easy. Text the word check to 503-226-5111. We'll send you a link to a stimulus check calculator. And up next, masks. Maybe you've made one, maybe you bought one, but are you wearing it correctly? We'll have the answer. But first, a reminder about a common question. Has Oregon extended the tax deadline, which is normally tomorrow, April 15th? The answer is yes. The deadline is now July 15th. The federal deadline and the Portland Arts tax deadline are also extended to that same day.
Some in the U.S. have wondered why this country doesn't do widespread spraying of disinfectant of public spaces to battle coronavirus. It's a tactic often seen in Asian countries. Let's connect the dots. When this new coronavirus surfaced, you saw workers in protective gear spraying public areas in places like China and South Korea. According to reports, those workers were spraying everything from sidewalks to park benches with a diluted bleach solution. But there is a reason health experts are not pushing for that here. First, it is still unclear if bleach destroys COVID-19 in an outdoor setting, while it works in a controlled environment like your home. There are more factors at play outside. In fact, previous research shows that bleach actually breaks down when exposed to ultraviolet light. And according to the journal Science, there is another problem. Exposure to spray disinfectant can actually cause respiratory problems, not just to the workers, but anyone who happens to walk by and breathe it in. Repeated exposure has been linked to everything from asthma to chronic obstructive pulmonary disease. A reminder that there are not a lot of easy answers to this pandemic beyond stay home and stay safe.
And we now know that masks are an important part of stopping the spread of COVID-19. A viewer named Paul asks, what is the right way to wear one? He's seen a lot of people not covering their nose and mouth. Here's a quick lesson.
Patterned, solid, DIY, sewn.
When it comes to masks, it's not just what you wear, but how you wear them. And there is a right way.
Make sure you're covering your nose, at least up to its bridge, and your mouth around your chin. It should be snug without gaps on the side. While experts say simply wearing these could help us prevent the spread of COVID-19,
you could actually expose yourself to germs if you don't handle your mask properly.
One of the major things with use is you always want to wash your hands before you put the mask on.
Once you have your mask on properly, never just tuck it underneath your chin to take a break from wearing it. Not even in your car by yourself between errands or on the final stretch of your walk home.
Leave it on. It's not going to hurt anything because it's just going to prevent you from touching that potentially virus-infected piece of cloth more.
Once you're back inside your house, take off the mask using the ear loops, pulling the whole thing out and away from your face.
Don't touch the front, ever. Never, ever, ever touch the front.
then wash your hands and your mask before wearing it again. I can't help but notice you have something on your face right now, and that is a rather large beard.
Kind of the type of mask that the beard is really going to be a problem for are those N95 respirators that healthcare workers really need. The beard's not an issue in terms of cloth masks or even surgical masks, and that's generally the recommendation right now.
So you're not going to shave your beard right now?
I hope not.
Masks are great for any time you can't avoid encounters with people you don't live with, like if you have to run to the store. But so is social distancing. This is one form of protection, but you can't forget about your 6-foot bubble.
And up next, a question we should all be asking ourselves. Mental health experts tell us how to find out how we're really doing. But first, Jean wanted to know, should we still be cleaning our mail? The answer is yes. Experts say you do want to wipe down packages and mail and wash your hands after opening up or handling either of those things. I'd say one of our most common questions, if and when can we ease up on social distancing? Here's what Dr. Joseph Fair told me about the possibility of returning to a somewhat normal life soon.
I think, we will see a dip in the cases maybe over the later summer months because, I think by that time social distancing will be the norm across the country. And You know, like I said, we haven't seen the seasonal slowdown that we hoped for, that you normally see with a cold and flu season with this virus yet. That doesn't mean it's not going to take place maybe later in the summer. So, you know, we might still see that seasonal dip. And so I think we'll get to at least some level of normality in that time, but I don't think we're going to go back to, you know, shaking hands or, you know, having large and mass gatherings anytime soon, you know, at least before the end of the year.
And experts say there's one question we should all be asking ourselves. How are you doing? Catherine Cook has advice from a mental health professional.
Having been several weeks into this, it really is important to ask ourselves how we are doing, what we might do differently in order to feel better, and what techniques we could use as well.
Dr. Jeffrey Eisen is Chief Medical Officer at Cascadia Behavioral Healthcare. He says a big part of how we're doing hinges on whether we've created a new routine for ourselves during this time of social distancing.
If we don't have a defined or routine that can help us through each day, then sometimes we can just get stuck thinking and letting our minds go further than we would want them to.
Eisen suggests taking a daily walk.
Hi, Grandpa. Hi, Grandpa.
And also reaching out to loved ones by phone or virtually. He says it's an important part of our human nature.
And I don't know if we were aware of how much we enjoy our interactions in connecting with others until the times where we're not even going to the grocery store as much and saying hello to people.
This is NBC Nightly News with Lester Holt.
Experts say how much media we're consuming might also impact how we're doing. Eisen says it's a good idea to set a limit.
Certainly very important to catch up on the latest news around COVID-19, but sometimes if we listen to too much, it can begin to make us excessively worried or anxious.
Here's something else. For those struggling with mental health or experiencing a setback from substance abuse recovery, know that help is still available.
Really important to realize that and to not assume that if you need help, that those services would be closed and not available, because they are absolutely available.
Finally, Eisen says there's something we can all do to improve how we're doing.
Just slowing down and taking a moment to breathe can be such a great first step.
Catherine Cook, KGW News.
And just such good advice for all of us. And thank you so much for joining us tonight. You know, KGW is committed to answering your coronavirus questions right here on KGW Q&A. And starting on Thursday, we're going to be doing a weekly web Q&A hosted by our own Galen Etlin. This week, he'll be talking all about navigating unemployment with some experts. You can tune in on KGW.com or on our social media pages. If you still have questions, go to KGW.com/answers.